Moving forward, we have today with us our chief guest, esteemed Professor Devrath Kumar from NIMHANS. And to introduce him, Professor Devrath is a professor of clinical psychology in Bangalore, NIMHANS. He has done his MPhil in medical and social psychology, PhD in clinical psychology from Central Institute of Psychiatry, Ranchi. Sir has more than 50 high quality research publications under his name. His areas of interest lie in cognition, neuropsychology, neuroscience, prospective memory, cognitive behavior therapy, metacognitive therapy for psychosis, and forensic psychology. Sir has guided several MPhil and PhD theses. Sir, please, I invite you now to speak your words.
Am I audible? Okay. First of all, I'm really thankful that all of you thought of inviting me as a chief guest. When Prashant called me and he said that could you be the chief guest of this program, I said I'm the most unsuitable person for this because I really do not know much about hypnosis. I've read about it, but then I have never practiced it. And then he said that you do not need to necessarily talk about hypnosis. You can talk something about psychotherapy or whatever you wish. So I said, fine. I would be, because I thought that this would be a great opportunity for me to interact with many of you who are experts in this area. And I personally know that this is a useful method. So I have prepared a very brief talk. I can share it, and then I can discuss a little bit more about that. So can you just allow me to share?
Yes, sir, we'll make you the co-host.
Sir, we have already done. You can share now.
Okay.
Sir, just a request. Could you please speak a little louder? Our viewers are asking to be a little louder. Yeah.
But when I'm trying to share, is it visible? Because I'm not able to see that. It's
Not yet. Not yet.
Okay.
I think, Manisha, you make it gallery view. Perhaps it is
Okay.
a different view.
Yes.
Now we are able to see that.
Okay.
Now we are able to see.
Yeah. Just yeah. So I thought that I will be talking about the area where we work, the psychotherapy, and I thought that we should briefly talk about psychotherapy in the rapidly changing world. This is something that all of us think that are we really in tune with the mental health needs of the today's world, because we practice what we learn, and then sometimes it just happens that you do not start tuning up with the needs of the world. So I think most of us, after in last maybe in 5 6 years or 10 years, we have felt that the kind of therapies we do and the needs are quite different. So what are those things, and how do we need to adopt to that? How we are adopting to that, and what are the other things that we can do? I'll just briefly talk about that, and then I'll try to contextualize hypnosis in that. But of course, I'm not no expert in that area. Whatever is my idea, I'm just trying to prove. So now, what are the challenges? Of course, these are. Okay. So the challenges are not new, but then perhaps they have increased manifold, and there are certain things which are of course new. So for example, we have digital overload. So you have, WhatsApp and so many things. I mean, I'm not part of, apart from WhatsApp, I do not have any other thing. So I really do not know much about this social media. But I know that, and since we see clients with them, it seems as if the world is overloading us with digital things. I mean, people becoming depressed because they have not got likes, people committing suicide because they have not got likes and all. This show that there are things which we have never been taught to face, and these are becoming kind of requirements for us to understand how to deal with that. um, uh, you have things, for example, we know that there are conflicts and war, inter-societal conflicts, intra-societal conflicts, uh, things which are happening. These were there, but then of course these are increasing, and they are increasing because you have the fights for the resources. You have population increasing, and there are just umpteen number of reasons for which we are facing these conflicts. And then of course you have economic uncertainty, poverty. For example, I stay in Bangalore, and I sense something very unique in my neighborhood, is that whenever there is any kind of economic uncertainty, for example, right now, I have got clients with the fears, and not one or two, because I have my OPD on Saturday where all the IT people come. People have come with full-fledged depression. The reason being that now everything is being taken over by AI, and I do content writing, and this content writing thing can be done very easily by AI. So what is my need? The codes can be written by AI. Then what is my need? So suddenly, someone who is in a very comfortable zone, earning lakhs and lakhs of rupees, becomes very economically uncertain, and this one. So it is not interpersonal issues. It is not the conventional thing by which we see depression. It's something that just emerged, and you do not have a history of depression. You do not have a reason to feel that this person has any reason, any biological predisposition or something by which he is depressed. Now, sometimes it becomes very challenging. I have cases where the person is depressed because he is not able to pay his EMI, and you do not know how to deal with that, because you can't say that this is something you are having a cognitive error. At the same time, you do not have a handy solution to say that this is how you can pay the EMI. But then this person is coming with a real depression. Um, you have loneliness and poor social contact. So this is again something I think we are seeing, at least in Indian context, we are seeing something very new, where literally social connects are eroding. So you have all the connects through, again, digital media, but then interpersonal things are just waning. I think all of us are feeling that when there is a real need or something, people feel very lonely. You have a small family size. There are parents who are virtually living without their children for years together, because children have shifted, or there is only one child who is studying somewhere or something. And then the last thing is that the ever increasing requirements. For example, I remember when I was a child, um, the family had real, very less requirements. I do not think we ever craved that we did not have a car, or why don't we have 24-hour electricity, or we did not have heard. We did not have a television. We had a two-band radio, and I think the family was very happy. But then you think about today, every day something new comes, and it gets introduced, and after a week or month or a year, it becomes a requirement. So it gets introduced, and finally, at some point of time, it becomes a requirement. Now, all these are creating distresses which we are not attuned to deal with. We do not know how to deal with that, or we do not have any focused set therapy to handle this. We have to apply, of course, the therapies that we have learned, but sometimes you fail to understand that are we dealing with really cognitive errors? For example, I give you an example that if someone has an increased burden of EMI and he has lost a job, can we really deal with CBT? So what should be the approach? How do we deal with that? Of course, we can do supportive therapy. We can talk about problem solving, but I think we need to have something more focused about these things. We need to tune with that. And the case is that are we really facing a mental health crisis? Um, are we talking? Are we seeing certain things um, which are very so when you talk about endemic and pandemic, we know that in the public in the context of epidemiology, the definitions are different, and of course you cannot say that depression is a pandemic, but then the way it is affecting people, the way it is, we are becoming very, people are becoming so volatile, that are we seeing something kind of a silent mental health pandemic, and are we really ready to deal with that, or rather are we really serious to tackle this crisis? We have some certain knee-jerk reactions, but then are we really tuning or trying to prepare ourselves about the core requirements that we are having, which can be quite dramatic shift from the regular requirements that we have. And now, if you, and this is something like I thought that I should be talking about the Indian context primarily. So these all things are happening in the background of a few facts that all of us know. Is nothing new that I am talking about. That we have very few limited mental health, very few mental health professionals who are trained. The services which are being provided are not sufficiently regulated, unfortunately. For example, when Sir was telling that how you are in a very systematic way proceeding to make it more professional and more, a body which can regulate. I think that is the requirement. For example, it's not the so-called professionals are not there in the society. The problem is that who is the right person? We are very, very poorly regulated, mental health in our country. The problem is that when I, as a mental health professional, or many of you as a mental health professional with sufficient number of experience, find it difficult to deal with some of these challenges that I'm talking about. Just think about someone who has not been regulated, who has not got a degree with poor exposure, dealing with this kind of problems. They can do horrible things with the person. And then you have some kind of rural and urban divide where I think that is a mentality also with us, that some people from urban background, they're more suitable for doing whatever therapeutic work you do. It's not very still for rural, though personally I disagree. I've seen that people from very rural background, from low socioeconomic strata with limited education, they do excellent in cognitive therapy if you really talk to them as someone who is equal to you. So I partly agree with this divide, but I partly disagree with this divide. And finally, you have lack of awareness where people do not know that, sometimes it's very unfortunate that, for example, I have had patients where I work with adults, and in adulthood, they have come with depression, they have come with all kinds of problems. And you go into the depth and you feel that there were, psychological issues in the childhood. For example, the person could have SLD, the person could have some other issues which were not recognized, no one was aware of that. The person was struggling with that, and finally he has lost so many productive years just because the system was not aware, the teachers were not aware, and the person has faced all these problems. So lack of awareness is something which is again so in this background I'm talking about the crisis that we are facing now. Now, how do we deal with that? And this is something that is just, I thought about it. It's not that somewhere written or something. That we need to increase the number of service providers. And when we are talking about service providers, it's very important that we need to have a number of trained service providers. Now, how do we do that? And I think we need to have a flexible approach. For example, the whole problem is that when we talk about mental health and those who can provide mental health services, we restrict things to a large extent, that only persons having this degree can do that. We are failing somewhere in creating a workforce who can deal in the front line, and then we can be on the referral centers. So we do not have sufficient number of frontline mental health workers. Now, frontline mental health workers, those who work as frontline mental health workers, primarily they are those people who are not trained. They have not got anything, and they just go and start dealing with people in different ways. And I think that that is very dangerous. So first thing, I think what is important is that we need to train mental health professionals. We need to have a workforce which is primarily a frontline mental health workers who do very focused thing. For example, you just take an example of the gatekeepers for suicide prevention. We know that suicide is the one of the condition which is highly preventable. We lose people, we people die because no one identifies them. Now we know that there are very effective gatekeepers training. We can create a workforce, we can create professionals, very semi-professionals rather, I will say, with 3 days of training or 6 days of training, and at least we can decrease suicide, the rate of suicide. You do say, for example, there is something called QPR training, question, persuade, and referral training for gatekeepers. It can be done in a day in a very scientific way, and if you have that, people can sense if someone has suicidal thoughts, and these people can be very very effective people in society who can prevent suicide. So you can have a workforce who prevents suicide. We have to think in that manner. For example, all those crises which are leading to this kind of thoughts, if someone can identify them, if a superior can identify his juniors, if someone is having those kind of thoughts because of those crises, I think we can prevent something. The second thing is that somewhere we are very intervention focused. We are still not in a promotive or preventive mode. So we do not do, so for example, you just take an example of life skills. We know that those 10 life skills given by the WHO are very, very effective in creating resilience in children. Go to any school, those all life skills are part of curriculum which are taught in class. These life skills do not need to be taught in class. They need to be part of the school environment. No one is sensitive to that. So we need to really shift to a promotive and preventive approach instead of remaining focused on the interventional approach. And as I said, that we need to have a short-term focused intervention, focusing upon some of these things. For example, you just focus upon some crises which are so unique, so particular that we are facing now. Can we have some short-term focused interventions on these things instead of making a person a clinical psychologist and this and that? We can have very short-term focused interventions. Those people are dealing with that only. I think UK has, experimented that, and they are very successful in doing that, where there are people who literally work as frontline mental health workers, deal with very few things, but they deal those things quite effectively. And then you have NHS recognized clinical psychologists who deal with the critical cases and the complex cases. So at the two stages, patients are being given the care. And the fourth thing is that we need to pay attention to the specific cultural issues. I think we are just copying the Western therapies without understanding some of the cultural issues. And that is how a disconnect is happening between the therapist and the receivers. So we need to think about it. Now, as I said, that there is a silver lining. We need to think about it. For example, post-COVID, the public awareness has increased. People have come to know that there is therapy. It helps. You should be free, and you should be, there is nothing wrong to ask for help. These are some of the things we are quite palpable. I mean, sometimes you feel that people are overboarding, they are approaching therapists, they are becoming therapist dependent. All these things are happening, but at least those awareness are coming. Um, I think all of us are also sensing that there is some interest in integrating the indigenous wisdom. For example, mindfulness. Mindfulness is Eastern thing, as someone was telling, that quite a few Eastern things is went to West and then coming back to East. So these are being integrated. For example, yoga is being integrated in a very effective way. I ran a project on how we integrated yoga in another therapy, and we found something interesting. Um, More empirically supported research are happening. This is one of the lack that our country has. I think we are failing to do those controlled experiment research in therapy and all other field, which can prove that this is effective, this is not effective, and these are the mediators and these are the confounders and things like that. But gradually, I see that people are doing good research and publishing in good journals. I am really happy to see that in past 5-6 years, some articles which have been published in therapy area have been published in very good journals, international journals, and I really feel proud about that. There is some expansion of mental health training program, though again I'll say that some of these programs may not be very well formulated, and that can have its own risks, but then at least we are seeing that there is an expansion of mental health training program. And fortunately, technology is coming as a bridge. So telehealth is coming up in a major way. People are receiving therapies online, which was just 6-7 years back. It was kind of one-off thing that we would do. Now people are doing it. So technology has become a bridge in a major way. With all this 5G and all, it becomes easy. You do not have all those the connections problems and things like that. So I think that is helping. Now I'm just contextualizing hypnosis in today's world with the caveat that I'm telling that I'm no expert in this area. Whatever little I know, I think all of you know more than me, is that I think all these crises which are happening, hypnosis can be really helpful because it has mind-body integration, to my knowledge, to my understanding. And actually this is what we require nowadays, to make people understand that your mind does not work separately from body, or your body does not work separately from your mind, and you just cannot keep pressurizing one and trying to make the other happy. That's not possible. We know that at least whatever I have learned, that hypnosis is very helpful in anxiety, pain, trauma, etc. And I think this is where we require some kind of help. If AOH can design some programs which are very focused on these things, and can really when you are imparting that training, you can make it very clear that you cannot go beyond this, so that people focus upon that and they become very useful resource for the society. And interestingly, I did some search and I found that wonderful studies are happening on hypnosis. So I saw lots and lots of fMRI research. I have some knowledge and some understanding of fMRI, and I found lots and lots of research on fMRI on hypnosis, which actually shows that hypnosis is not out of brain, it is happening there. And there is a biological mechanism for that. There is a neuroscientific mechanism for that. So the letterhead that the publication that you have, perhaps if you publish some of these things, that how because I may be wrong, but I think society sees hypnosis as something it has its own kind of, you can say, aura, or kind of some misunderstandings people have. So I think if you write articles in newspaper or in your letter that you're publishing, where you write brief articles and try to make people understand that it is no kind of something that you are doing without having scientific support. It is as scientific as anything, and those who are not doing scientific things, they are not doing the justice, they are not the right person. So people will be able to understand who is the right person, who is just doing trying to make out things out of it. And if they are getting hypnosis done, it has its own limitations, it has its own strengths, it has its own neuroscientific basis. So I think that will be really helpful for people like me. In fact, I would be really interested in learning some of these things if you come out with any focused program on this. So thank you very much for giving me this opportunity. And I know that I was not able to talk about hypnosis, but I just talked about something that we face day in and out. I hope it just gives you some kind of thing to think about. Thank you.